If you have symptoms of mental illness in in San Francisco and you go to Singapore, you might not be diagnosed with mental illness at all. If you go to Nairobi, you might not be diagnosed with a mental illness. You might actually be promoted to the tribe. If you go to Reykjavik, you might have something you might be more in line with your cosmic self. There's all sorts of different ways of looking at whatever this mental illness is. It does not have a unique, ubiquitous definition. Without a unique, ubiquitous definition, it is nothing more than a conversation that's culturally based. It's simple as that. There is no definition for what mental health is. And therefore, how do we have the audacity to declare that we understand what mental abnormality is? We don't even know what normal is. None of us have a good definition of that. So what ends up happening is the clinicians are calling people abnormal when they fall outside of the box of what the clinicians have defined as normal. So it's really in the eye of the beholder, much more than, and if the eye of the beholder says there's something wrong with you and you agree that there's something wrong with you, now you've got a match. You can walk away saying, I was finally told that I have the blip. And because, that's good, because now I have an explanation for the fool that I've been, or the things in my life that I don't appreciate about my habits. Like I relinquish responsibility for my life sometimes by getting that diagnosis. It turns out that psychiatry is the only subspecialty that I know of that if you tell someone who comes into your office that they're okay, that there's no problem, they get really angry with you.
That the person coming in gets angry with you.
That's right. Yeah. If you tell them there's nothing wrong with them, they're coming in to find out exactly that there's something wrong with me,
doctor.
That's right. But if you do that with an oncologist or a cardiologist, if they say you're okay, you're like, cool.
Yes.
With psychiatry, I've tried that before. Number one, you don't get paid by any third party payer. So every single person who comes into a psychiatrist will get a diagnosis. Because you can't, if you write no diagnosis, there's no payment coming.
Interesting. Yeah. It's so true. I actually have never had that conversation with a psychiatrist before, but wow, you're right. You want to go to the oncologist, you want them to say, no, there's nothing wrong. You don't have cancer. No, your heart's fine, sir. So what do you do? I mean, the component of this is somebody's head's underwater, they're suffocating in symptoms and they don't feel right, Dr. Fred. And they're coming to you and you said, well, it's just your perception.
Not at all. I never say that.
No. Okay. So what do you say?
No diminishing, no minimizing at all. Absolutely. Their experience of feeling out of place is very real. Their experience of feeling sick or disconnected, or hopeless or helpless or nervous or fearful or tired or any of those low vibration experiences.
All real.
All very, very totally real. So it isn't like it's just in your head or just perception, but we're going to go at this in a different direction and find out what's been happening in your life. What have you been doing with yourself? What has the world been doing with you? What are some of the possible implications of the way that you're living life leading to the so-called symptoms that you're having? Maybe you're eating way too much sugar. Maybe you're drinking too much coffee. Maybe you're watching too much pornography. Maybe you're having, you're being bullied at school. There's all sorts of things that could actually lead to some very real psychological discomfort and psychological dysfunction, for sure.
Yeah. And then what is the appropriate time to undoctor yourself here?
Yeah, before you get started.
Okay. And then the next best time is today.
After you realize that you're not getting the life that you want from the treatment that you're using, that you really are ready, willing, and able to undo yourself from the idea that there's something inherently wrong with you.